Good morning. Welcome to Plastic Surgery 90210. Hello, Dr. Katzen. Who are we here with?
We're here with Emil, and Emil is my long-standing friend for at least
5-6 years.
5-6 years, and we've worked a lot together on weight loss.
Weight loss and anti-aging HRT, but mostly weight loss, correct.
And the main thing now is sort of all this avalanche of these wonderful FDA-approved, really works weight loss drugs.
Correct.
And I mean, everyone's sort of heard about Ozempic. That's sort of the buzzword. But let's talk about Ozempic, and let's talk about the other ones and what they do and how they work and how you can get your hands on it.
So Ozempic is the brand name of a medication called semaglutide. And semaglutide is a GLP-1, glucagon-like peptide factor.
Okay.
When we eat, our stomachs release a hormone that basically regulates the blood sugar and food. GLP-1, correct. Glucagon-like peptide.
Glucagon-like peptide.
So they found out, this was a diabetes medication, but they found out one of the positive side effects was immense weight loss. People are losing 15% of their body weight in 1 year. They're losing fat off their waist, 6-7 inches, and they're not doing anything. There's no diet, no exercise. So this is basically the first time in history we've come close to a magic pill. And I've been in the weight loss industry since 2006 and seen tens of thousands of patients, but this is it.
This is it.
This is it.
All right, very good. Are there any side effects?
Minimal side effects.
Yeah.
I tell people it's usually nausea and vomiting and that type of stuff, but that's because a lot of people are overdosing and they're still sticking to very unhealthy, bad diets. So if they regulate their diet a little bit, change it a little bit, and we inform them what to do, those side effects are minimal.
Gotcha.
And then at the end of the day, Dr. Katzen, no matter what side effects you have, it's nothing compared to diabetes, heart disease, and so on and so forth. It's well worth a few months.
Exactly. One of my patients told me, oh yeah, I've been on Ozempic and I hate the side effects. I'm like, well, what side effects are you having? Well, I don't get to eat. I'm like, well, the whole purpose of the drug is decreasing your eating and what you're eating and to eat better. So, the whole purpose is to lose the weight, and that's how this
And that's exactly what's happening. The GLP-1, basically, the semaglutide triggers the brain into thinking it's full. As opposed to when you go on a normal low-calorie diet, your brain goes into shock, thinks it's starving, holds on to your fat, and then sends you signals, Dr. Katzen, you're starving, go get food, and all you think about is food.
Is eat.
It's completely different, and this does the opposite. So in essence, when we go on diets, you're fighting biology with your willpower, and you're going to lose. There's no way. In the long run, you're not going to win.
Right.
This is the opposite. You now have biology on your side, and willpower is an added extra.
Got it. And what are there's Ozempic, of course. What are the other ones,
So the other ones right now are Ozempic and Mounjaro. Those are the two ones, tirzepatide and semaglutide. But when this all started, we knew that this would unleash basically an arms race where all the big players were going to come in and start creating better molecules to add to them. And that's exactly what's happening right now.
Gotcha. How do you determine which one to use?
We can actually use both if we wanted to, but we will basically put people on semaglutide and then try tirzepatide.
Gotcha.
And that should be enough. But then the results now of a new product, which I won't mention now, we'll keep it as a surprise. It's going to radically change everything. They've added a molecule to it, and it's going to be an oral dose.
That's
instead
amazing.
of injections, correct.
Yeah, so right now they're all injections.
Correct.
And they're in the process of getting the oral forms released. Yeah.
Correct.
And at least in California, there's a pretty tight market. In fact, I was reading some international countries say, there's such a shortage, we're not going to dispense it anymore. So I imagine with these new medications coming out, the competition will sort of increase, so there'll be access to more drugs.
Correct. The supply will be better than the demand will be, because right now the demand is so high that a lot of people can't even get this for diabetes.
Exactly.
The good news is that semaglutide, which is exactly what Ozempic is compounded in certain pharmacies that we have special relations with, that we can get that product at about a third of the price or half the price of what they would be purchasing the brand names for, and they're losing the exact same amount of weight.
Yeah, so that's pretty amazing. So if you're thinking about going on these medications, give us a call. We'll consult with you to see if you're a good candidate for these medications, and then also you'll meet with a registered dietitian who will make sure everything is appropriate for you, and then we can get you these medications not only prescribed, but actually get them in your household so you can take them. I mean, a lot of patients that I find, look, I've had my prescription for 3 months, months now, and I haven't lost any weight. And I asked the patient, well, are you taking it? Well, I got the prescription, but I can't find anybody to fill it.
The medication, correct.
So that's
we have access to that.
Yeah, so that's one of our major problems in California, but now we've solved it with our vendors, with our pharmacies.
Correct.
So for a normal person, I don't really understand what you guys are talking about.
Yeah.
What does this medicine do to our body besides trick our brains into being full?
Well, first of all, it tricks your brain into being full so you're not hungry. And that is the number one reason why everyone cheats on diets, is because all you think about is food. So of course you're not going to fight that craving. People don't like to sacrifice. And that's what happens. So that's the most important thing. The second thing is that it regulates your blood sugar optimally, so you do lose fat. You don't put on fat, basically. When your blood sugars are playing around a lot, what happens is you put on fat that way. And that's what you don't want to do. Those are the two main reasons.
And the GLP, the G in there is glycogen, and glycogen's a key molecule in your body which regulates sugar. And basically, when you have that glycogen-like, it's like glycogen, and when you get that shot in you, your body's like, oh, there's glycogen. And when your brain sees glycogen, it's like, oh, we're not hungry anymore. And you just don't eat. You actually have to remind yourself to eat. You have to eat, and you have to drink. That's very important too. A lot of people don't drink as much. So one of the side effects can be, dehydration, not drinking enough. So you got to drink.
Okay, got it. And are there negative side effects with these medications?
Sure.
Weight loss.
That's a positive one.
Yes, exactly. So so that's not necessarily a side effect. So rare. Again, do you want to have diabetes? Do you want to be overweight? Those are much more horrific and
it's
much more
basically a
detrimental.
cost-benefit analysis. Do you want to, for a couple of months, have issues with your stomach? And that's not everyone. That's just a percentage of people, a smaller percentage of people, which improves with an improved diet. Or do you want to continue doing what you're doing and fail? I mean, if we look at the weight loss industry, we have, on average, at any given point, 49% of adult Americans are actually on a diet right now. We have 80% of Americans either overweight or obese, or diabetic, pre-diabetic, or close to. So those are astounding figures. If weight loss has worked, then why is this happening? How did we go from where we were in the 70s to this? Weight loss is not working. This is the only time in history that weight loss will actually work. We have basically bariatric surgery results without the surgery, and that changes everything.
So if you can catch obesity before it becomes extreme, requiring bariatric surgery, that would be ideal.
Absolutely ideal.
That would be ideal.
Correct.
Yeah.
And is this something that you have to stay on for the rest of your life?
Absolutely not. If you're trying to lose 50 pounds, you do it for a few months, you lose it, and then you could be able to change your lifestyle much easier. It's difficult when someone's 50, 60 pounds overweight, tell that person, him or her, to go to the gym, eat healthier. First of all, they're not going to do it because they're tired, they're stressed, and they just can't do it. But if they've lost that 50, 60 pounds, now they can start afresh and have the confidence to do so.
It's sort of like a reset. You take the medication, you drop the weight, you go off the medication, and then you're like, oh, okay, thank you. And now I know how to eat, how to exercise, and you can continue.
When we were speaking to a bariatric surgeon, he was saying that he doesn't necessarily recommend this for morbidly obese patients. He would recommend the gastric and then maybe this to assist in the long run. Well, what is your stance on that?
Correct. I think that's reasonable. And these are cases of morbid obesity, 100 pounds overweight and then plus that. So in patients like that, those patients may respond quicker, faster, better to gastric bypass than maybe an oral pill. But we're talking about the majority of patients, the majority of Americans that aren't morbidly obese, but are just obese.
Got it. Okay, what does it feel like to be on something like Ozempic or Mounjaro? When I spoke to people, they say sometimes they feel a little constipated.
Yes.
Can you talk about that?
So people get constipated because they're losing weight and they're not eating as much as they did before. But that's easy to remedy. You can have some aloe vera pills. There's so many natural supplements to take.
And again, hydrate, make sure you're drinking plenty of water.
Correct.
And one of the ways this molecule works is it slows down your GI system. So imagine sort of a train going from your mouth out, and it basically just slows down the process of the absorption of food. And with that slowing down of the train, your brain says, oh, train is full, we don't need to eat. And that's another mechanic of the way it works.
Does this reduce the chance of getting diabetes for people?
Absolutely.
Yeah, not only reduces it, if you have diabetes, it reverses diabetes.
A1C levels they've been drastically improved in about 70% of patients within a few months.
Yeah.
And that's important.
So, and diabetes is catastrophic, affecting pretty much every organ system in your body. So if you can reverse diabetes or prevent diabetes, that's a breakthrough. Yeah.
And you were talking about new types of medication coming out that you don't have to inject. Let's talk more about that.
Correct. It's exactly the same medication, but now they're finding an oral version of it. And the reason, you'll take it daily. But people would rather take an oral pill every morning than coming into a clinic and getting an injection or even injecting themselves. A lot of people are averse to doing that, which is quite understandable. But the point is now that it's an oral pill, it's going to be cheaper to manufacture, it's going to be easier to distribute, easier to take, and prices will go down.
Yeah, you don't have to refrigerate it.
Correct.
You don't have to worry about traveling with needles and all that jazz. So yeah, think about it. I mean, they've got the injections, and they just have to perfect how to make it a pill to be also absorbed in your GI system. So
Correct.
just let the chemists and the pharmacologists figure that out.
So the good news is the new product that I'm talking about, I won't mention now, we'll keep it for our special clients, is so semaglutide studies show 15% body weight on average after 1 year. This is over 23%. So it's a much better product.
Yeah.
Much better medication, rather.
What are the chances of people getting this covered through insurance?
Very slight. Some diabetics can get that, but to lose weight you can't, and that's the issue here. So you have to go and buy the brand names that's over $1,000, $1,200, $1,300 a month. But with their compounded versions, which are exactly the same, exact same molecule, you can get it for about half price.
What do you need to do to qualify to be approved for this medication?
So generally speaking, you just have to come in with a smile. No, so what happens is you have to have a BMI of at least 25 to qualify for this. And second of all, no thyroid cancer in the past 5 years. That's basically the two. That is the...
Yeah, consult with us. We'll take a good thorough history, nutrition history, diet history, physical history, past medical history, surgical history. Make sure you're healthy for the medication, but most people qualify.
Correct.
Most people qualify. And say you lose the weight and you're still on Ozempic, Mounjaro, etc. If you're going to get surgery, plastic surgery with you after, do you have to stop the medication prior to surgery?
Yeah, so again, remember the way it works. The way it works is it slows down your GI system. So we ask you to get off those medications for about 1 month. Why? Not necessarily to do with the surgery, is because when we do anesthesia, if your GI system is slowed down, there's a possibility of when we give you the anesthetic that you could vomit. And if you vomit and it goes into your lungs, you can get a pneumonia, you can wind up in the hospital for a long time. So it's not necessarily to do with the surgery, it's to do with the anesthesia for the surgery. So the reason we ask you to stop that for a month is because of the GI issues.
Great. And can you get back on the medication
Absolutely,
after?
absolutely. Now again, for the surgeries, you need protein to heal. So if you're not going to eat the protein to heal, that's going to impact your healing ability. So we probably want you off these medications for about a month after the surgery, so you get the protein in, so you heal, and then once you're healed, then you can go back on them.
Okay. Does this medication permanently change your metabolism?
It should improve it in every aspect, correct.
So once you get off of it, is your metabolism still faster as if you were on it, or is it...
Well, that's a good question. The thing is we don't usually check metabolic rates before and after because we see the weight loss. But generally speaking, if you start working out immediately after this, your metabolism will improve.
Okay. I'm just wondering because I know people are going to be curious, once I get off of it, will I gain a bunch of weight back if my diet stays the same?
That's going to be very difficult to gain the weight back because at this point you're a completely different person and now you've been given a chance to start life again in a much healthier manner. And why would you go back? Most people don't. And if they do, they always know they can come and do this for another month.
Yeah.
And,
So by far the minority of patients gain that weight back. You go on the medication, you lose the weight, you know how to eat, when to eat, what to eat. You're going to be exercising. So when you go off those medications, then you're going to know those lessons that you've learned while being on the medication. So if you continue those, you shouldn't gain the weight back or pretty much gain any weight back.
Okay, and let's talk about some misconceptions about these drugs. A lot of people say, you're going to have Ozempic face, or like we were just talking about, going to gain the weight back right away.
Yeah.
Can you address some of those?
The Ozempic face is basically just losing volume of the face. Sometimes it can be just from dehydration, okay? Sometimes it can be actually loss of fat from the face, which is very common in any kind of weight loss.
Correct.
So when you lose volume of the face, from weight loss, maybe we need to restore some of that volume. So that can either be fillers or maybe even a facelift. But the Ozempic face has to do with the weight lost and the dehydration from the Ozempic.
So if you
Yeah.
were to lose weight, that would happen naturally. It's not because of the Ozempic or these drugs.
Correct. It's not the drug, it's the effect that the drug creates. And the incidence of that is extremely low. Extremely low. Yeah.
Okay, great. And let's talk about you, Emil. How did you get into all these weight loss medications?
So I've been in the weight loss industry or in weight loss space since 2007, where I started with the HCG diet and phase, which is nothing as good as compared to this. I was the fattest kid in school for 10, 12 years when I was in England, and I was always made fun of and bullied and so on and so forth. And that changed my life. I said I didn't want to be like that. I wanted to be healthy and look better. And so that's how I actually got into the weight loss space. And as far as these, it's just a natural. I keep up to date always, and I share it with you most of the time,
Yeah.
of what's going on. And this new class of weight loss drugs is the future. There is nothing that's going to alter that.
Have you seen a lot of celebrities on these drugs?
Yes.
Everyone's on them, they're just not telling you. I swear.
Elon Musk is
Elon.
very clear about he was on the product, yes,
Yeah.
on the medication.
So if it's good enough for Elon, good enough for me.
Good enough for us,
Yeah.
yes.
And what do we know about the long-term effects of these drugs?
Well, the GLP-1s are basically secreted into your stomach. There are no long-term effects in the sense that anything bad might occur or there might be damage. It's generally speaking is you now have a chance to get your life back on track to be healthier.
Yeah.
And that's generally it.
Yeah.
There's no...
And these aren't just fads. These are things that have been studied by our U.S. government, U.S. FDA. I don't know when they put in their initial application, but it's taken them years. And thousands of people have been studied to make sure that these are safe products. So they're not just, oh, we discovered this a couple of months ago, release it to the public, see what happens. No, these have been studied by the U.S. FDA. They're certified. They really, really work.
And they've been used as diabetes medications for many, many years,
Yeah.
and other similar medications like that. So
Yeah, and sort of the breakthrough is, the ability for us to use it for weight loss patients and to treat obesity and not just be restricted
which is
to
probably
diabetes.
our biggest issue in our country. I mean, if you think about it,
Absolutely.
if no one was overweight or obese, probably 80% of all high-risk factors would disappear anyway.
Absolutely.
And people would be a lot better off. They'd sleep better, they'd be in better moods, and so on and so forth.
And I mean, obesity is the number one highest health problem in the U.S.
Absolutely.
Period. That's it.
I mean, right now it's about a $70 billion market. That's how
Yeah.
much people are spending to lose weight. This is before these GLP-1s
Yeah.
came on board. But look at our success. It's
Yeah.
terrible. It's a complete failure, basically.
So are Weight Watchers part of the GLP-1 game?
They actually, comically enough and smartly enough on their part, they actually purchased a company, I can't remember the name, but that company was doing the GLP-1s, the semaglutide, so now that's what Weight Watchers, they were smart in that way to shift from the nonsense, because quite honestly it was nonsense what they were doing, and go into this,
Interesting.
into this space, yeah.
I didn't know that.
So what does that tell you about these drugs?
It's the future of weight loss, and anyone who does not jump on board and do this is going to be left behind.
Yeah.
How does someone get started?
Give us a call. All right.
619-373-2852. You can text 7 days a week and you'll get a response.
And we'll meet with you, consult with you, make sure you need the medication, make sure you're healthy for the medication, make sure it's indicated, and then get the medications to you.
So you can get your best results as well.
Yeah.
Great. And you offer in-person and virtual consults or what?
Yep. We offer in-person consults. You come to the office. We have offices here in Beverly Hills, Los Angeles, Las Vegas, or we can do virtual pretty much anywhere in the U.S.
Final messages, you guys?
Just do it.
Just do it. Yeah. Lose weight.
Change your life, live longer, be happier,
Yeah.
so on and so forth. Why not?
And yeah, it makes it so much easier now.
And are you on any weight loss drugs right now?
I'm actually not on any of the weight loss drugs, but I am on hormone replacement therapy, HRT. As we get older, our hormonal levels decline, so you start getting older. So all we're doing is putting back the hormones we had when we were younger, So now we start feeling younger and looking younger. Correct.
Okay, and are there any negative side effects to
Not
that?
at all. Yeah, as long as you're not abusing it, because we aim for not normal, we aim for optimal levels, and that's what we do. Physiologically optimal levels.
So we're just replacing things that are naturally lost as you age.
Correct.
That's all we're doing.
Got
Exactly.
it. So it's like Botox for all of you.
For everything.
Sort of.
But
sort
everything.
of.
But it's also
Yeah.
massive health improvements. Men that have high testosterone levels are not getting heart attacks as men with low testosterone levels, and so on and so forth. Libido, sleep, from skin, going to the gym, muscle, wastage, and so on and so
Yeah.
forth.
I mean, hormones control everything.
Everything.
I mean, they're sort of the control button for the entire body.
And we offer that in office?
Yeah, so basically you'd come in, we'd consult with you, we'd draw your blood, send the blood out for analysis, see what's low, and formulate an individualized, personalized
Correct.
plan to replace those hormones that are missing.
And the best part about this is you'll feel a difference within days. 7 to 10 days, you already start feeling a lot better.
Yeah.
Okay, great. Well, I think that's all the questions we have right now. So thank
right.
you guys so much.
Thank
Well,
you.
thanks for having us.
And we'll see you next time.
Great,
Okay,
thank
bye.
you.
Smiling.
Bye.
Thanks.